here we go. So welcome everyone. We're so glad you're here. This is the 5th installment of the Sanders County Democrats monthly virtual cinema series, What Unites Us. And the intention of this 6 months virtual video series is to get past the barriers of division and partisanship that we find our county, our state, and our nation in, and instead focus on topics that unite and support us here in rural northwestern Montana. And so far we've talked about farm to school programs, building our local economy, providing needed health care, promoting quality public education. And next month we hope to be featuring our veterans and ensuring local services to our veterans and active military. These programs are recorded. They're available on our website. And I hope that you know how to interact with our speakers who will be on today. You'll be given the opportunity to ask questions either by typing into the chat, or if you use the response icon at the bottom of your screen, you can raise your hand and that puts you in a queue. I will be muting everyone, so if you have a question, you'll have to remember to go to that lower left-hand corner and unmute yourself. Lastly, we hope that all of these cinema series leave all of us with a hopeful note of possible engagement and action. Today, we're going to start out with a video, and I need to share that screen. So sorry, I forgot to do that. I am not as adept as I should be. Here I go to my Zoom. There we are. So I will share my screen. I will mute everyone first. Actually, I can't find, oh, here we are, mute all. And there you go. And I'm going to share my screen. Sorry for the delay. Okay, and we hope that I'll make that big in just a second. And I'm looking at you, Deborah.
We're looking at how young people today are overcoming the enormous pressures they can face growing up in America 2017. Like the Montanan teens that we met recently who stood up loud and proud and said, even a cowboy can get a little blue or outright depressed. But luckily, even cowboys have a 21st century tool to help them find help. Watch. Growing up in Montana, you see it all. Scenic wonder, pig wrestling, and cattle branding, all standard.
When I brand cattle afterwards, it's like the most stereotypical thing you could do. We get by the big bonfire and we sing country songs to a live guitar person.
Yep.
I've been there. Very stereotypical.
Stereotypes aside, Caitlin, Teddy, Fiona, and Rylan are all typical teens. They also all struggle with issues of mental health. Teddy has suffered from clinical anxiety since the 4th grade.
I always felt like there was this pressure on me, like there was this weight on my shoulders, and I couldn't really define it.
Fiona as well.
I have crippling anxiety.
Caitlin deals with multiple chronic illnesses, including arthritis. She's in the doctor's office every week.
I'm going to be feeling pain my entire life. I'm never going to get a second where I don't feel pain.
When Rylan was just 14, he had an accident on his dirt bike.
I got a stage 3 concussion, and with that concussion, it broke some of the nerve endings in my brain that deal with like emotional stress and trauma.
While he was recovering, his best friend committed suicide. A month later, he lost his uncle the same way.
I completely broke down, and it was very, very bad.
Each of them has either attempted or had suicidal thoughts, and they are not alone. For the year 2014, Montana had the highest rate of suicide in the United States. And between 2005 and 2014, suicide was the #2 cause of death for children ages 10 to 14, adolescents ages 15 to 24, and adults ages 25 to 44. There's a host of reasons why: access to alcohol and firearms, social isolation, and a cultural stigma against depression that often prevents people from seeking help.
We have the cowboy up mentality. You're going through something personal that's a little bit mental, cowboy up, you're gonna be fine.
Yeah, you have to pull yourself up by your bootstraps every single time.
Because you need to be rugged, because you're a Montanan.
That's where Let's Talk comes in.
Cowboy Up. That's really what drew me into this particular video. And also it's about Montana kids. Sorry. Whether you're 12, 17, 27, 57, it's a cultural comment that pervades what's perceived to be our Montana way. Sanders County Democrats chose April to focus on public health. We made a strategic decision to do a deeper dive to try and highlight the state of mental health in our state and our country. We live in a culture that pushes individualism when it has been proven that it takes a community and a connection for all of us to succeed. Our state and our county's culture often pushes back in acknowledging the importance of and addressing that need for all of us, for each of us to attend to our need to address our mental health issues. There's a stigmatism attached to doing this, and we need to counter it. Everybody who's on here, and we need to spread that word. And the well-being of our county's mental health system is critical to the well-being of almost all aspects of our social and governing networks. I want to share the following, might be kind of a tough screen to share, but I would like to add one more share before we go to our speakers. Sorry, I don't see it up. Because I can't find it right away, I'd like to jump into our speakers and have them, and then I'll share this closer to the end of our program. So I'll put myself on mute, and Deb Ahatz, who is the MC of our particular program this month, take her away.
Okay, well, first of all, I want to thank all of you for coming today, and most especially to thank our professionals who are sharing not only their time with us today, but their knowledge, their experience, their expertise on this subject. The first person to speak today is Lynn Beerwagen. Lynn is the State Probation and Parole Officer. In fact, she is the only Sanders County Probation and Parole Officer who is covering a really large and sprawling Sanders County. They really only address adults. And as far as Lynn's qualifications and how she got to where she is now, I will defer to her to explain all of that. And so Mindy, thank you for chewing up Lynn Beerwagen.
Thank you, Deb, and thank you, Mindy, for inviting me. I hope I have the gist of what I'm supposed to speak about today, and I can stay within the time frame that I am allotted. I also prepared a PowerPoint that I did send to Mindy, and hopefully we can have that go up because it might help people. So I started working for the Department of Corrections almost 13 years ago after working for, I think it was about 7 years with the Sanders County Coalition for Families, which helped me understand the victim side of dealing with people who have committed felonies and have been convicted of felonies. Thank you, Mindy. Anyway, and so I've graduated from the Montana Law Enforcement Academy in 2019 after serving as a probation officer tech. As a probation officer for the state of Montana, I follow adult felony offenders from the time of arrest through to community supervision. And there's a couple different stigmas besides just mental health issues that we're dealing with here, is that I'll give you a couple of stats. Of my current caseload in Sanders County, 46% are registered sexual and or violent offenders. 61% have mental health issues that have been diagnosed, and 71% have chemical dependency issues. That's a lot. And so a lot of what my job is to follow them through the process and support the prosecutor in providing additional information, because they might also be currently on probation when they're arrested. So as you can see, I hope everybody can see the first slide. I'm going to follow it through from arrest through discharge of sentence in Sanders County. Somebody that has a mental health issue, this is the experience while they're dealing with their mental health crisis or issues, and maybe drug issues as they go through the system. And some of the considerations upon arrest for law enforcement is trying to figure out at the time that they respond to a call, is it a mental health crisis? Are we dealing with a crisis of an overdose of drugs, a crime, or all three? And the law enforcement has to consider everyone's safety. So then the person, if they're arrested, then detention has the challenges to schedule medical to deal with the mental health crisis or the medical crisis or potential drug overdose or detox. Detention has to determine who's going to pay for those services. Is the Department of Corrections, because the person's already on probation? And if they're not, does the person have insurance or Medicaid? Or does the county absorb the brunt of that expense? And that expense is typically a trip to the ER, which we all know costs quite a bit of money. Sometimes it's a simple appointment with a medical provider at the Thompson Falls Clinic or with Dr. Lovell. The jail has to deal with isolation of that particular offender, that individual. I'm going to use the term offender because at this point, they're a suspect, that they're referred to as the offending person. But I want to remind you that no matter what label I use throughout this process, we're talking about human beings. And I like to remind myself of that, as well as remind anybody as we're going through the process, because even though ultimately I may supervise them, they're still human beings that need assistance. So the challenge with isolation is it might be required for their safety or the safety of others. It might be required because they have to observe them detoxing, or the person might have been violent. And so detention has to assess them. So then they start through the pretrial process and they have to appear before the court. And again, some of the challenges are safety, because maybe they haven't had a mental health evaluation yet. We don't know if they're a violent offender. It's going through the process, getting them from the jail to the court and back to the jail safely. If the person has identified that they have some mental health issues, the court has to determine if they're fit to stand trial and start obtaining mental health evaluations. Or updating evaluations. And that is a challenge with our current system. We don't have anybody that I know of that will go into the jail to do the evaluation. Transporting them to the hospital may or may not get them an evaluation. And certainly the Warm Springs has their own set of challenges right now. We had an individual that took 9 months just to get to Warm Springs just this last year to get a mental health eval to see if he was fit to stand trial. 9 months is a long time to wait to be determined whether or not they could even stabilize him on medication. Of course, there's always community safety. And then the delays, there's always court delays, and getting a mental health evaluation may delay it, like I said, 8-9 months. So then during this process, the prosecution has to consider whether or not they're going to do a plea agreement, and what does that look like. There's a lot of considerations for prior criminal history, mental health, substance abuse or substance use disorders, identifying those or not, kind of weeding all of that out, and again, keeping community safety in mind. Moving forward, the defense has challenges at the same time as the prosecution and the court in this pretrial process. And the considerations are, again, are the fitness to proceed, and all of those issues that come along with that, the prior criminal behavior, and of course, the defendant's safety. If this person has been a victim themselves in some way in the past, they become vulnerable to anybody that is a predator within the jail or the detention center that they're being held in. If there is a certain class of individuals that are identified as potential victims during a Prison Rape Elimination Act assessment, and that's kind of hard to say. So during that process, of course, the defense is looking out for the defendant's safety. Backtracking, the jail is also looking out for the defendant's safety. They're also looking out for the victim's safety through this process. Next slide, please. Or do I do it myself? I don't know how this works. Okay, so during the process to decide if the defendant is fit to proceed, the challenges are the right to a speedy trial. Is the defendant going to waive his right to a speedy trial, or is the prosecution? The right to a speedy trial, I was trying to find the time frame, but it's something like, I want to say 1.5 years. I can't remember exactly, but so at some point, does the defendant waive the right to speedy trial because they may have some mental health issues that they're using as a defense, or they need to be stabilized in order to even stand trial. So again, back to the Warm Springs challenge. Warm Springs has a staffing shortage of about 40%, which causes concern for everyone's safety at Warm Springs. They've had some recent assaults there. And just like I said, just getting an evaluation to get into Warm Springs, you have to wait for a bed to become available. And the time frame is a 6 to 9 month wait at a minimum. Providence Center is sometimes considered. If the person did not commit a violent crime, the court may allow them to be released from jail if they go directly to Providence. But Providence, unless there's a tricky commitment to Providence, whether it's a self-commit or a court commit, because they're not a lockdown facility like Warm Springs. It's not quite the same. And I have to admit, I don't know exactly the difference between the two. I just know that Warm Springs is more secure. And then there's always the challenge of transporting safely, both for staff and for the offender, especially if it's somebody that is fighting the process the whole way. You know, they may have to shackle them in a different way, maybe have them in a jacket, you know, and there's challenges with that. The jail has challenges with isolating somebody for too long, that might be a trigger for their mental health issues, and doing that balance of when to let them out of maybe an isolation cell, because the jail, they have a certain amount of training on how to deal with inmates with mental health issues or somebody that is detoxing, but they're not mental health experts. So it's a tough balance. It would be nice if we had somebody that would go into the jail and do those kinds of assessments, but at this point, we do not. The other challenge is getting them their medication, whether their medication is at their home or they haven't been on it for a few months and they need to go back on it. They're willing to go back on it to stabilize themselves, and then getting them to a doctor to re-prescribe that. And that's where, again, I step in even in pretrial, because if the person is on probation or parole, then I may step in and try to retrieve that medication from a family member or out of their home or something and deliver it to the jail. During this whole process, there's an ongoing assessment about whether or not they're suicidal or homicidal, have expressed any verbal threats to anybody. And then, of course, that changes what we do during this process. But again, we don't have a mental health professional going into the jail that I'm aware of. Sometimes I will go in every 2 or 3 days to talk to somebody that's on probation or parole, so that I can do some risk assessments, because I have had some training in suicide prevention or de-escalation. And so then by doing that and checking in with them, they know that, or at least hopefully they get the message that somebody cares enough to check in on them and gives them an opportunity to vent whatever's going on, and I can help alleviate some of that anxiety or whatever, and maybe speed up the process of getting them in to speak to a professional. And of course, there's the challenge of confidentiality. So transport, again, if they've made the appointment or they are going to transport to Warm Springs or to the doctor's office, it's typically, they don't let anybody know. They don't let the offender know, because they might tell a family member, and it's an opportunity for them to make an attempt at escape. There's staffing shortages, even not only at our jail, but across the state of Montana. During pretrial with court, the court has to consider the results of those evaluations. So going back to the fitness to proceed, even if we got somebody into Warm Springs within 6 months, it's going to take a couple of months before we even have the report. So again, the right to speedy trial enters into this. So from the time of arrest until this pretrial of looking at the evaluation could already be a year, and they're incarcerated the whole time. And so that also is of concern. And that's why I try to educate myself enough to provide that support through this process, because they can't just step out and go see their regular therapist. However, I can ask the therapist, and some have done this, if they were already established, they will go and visit with them at the jail. So during the pretrial, then based on the evaluations, they decide whether or not the individual is actually released back out into the community, considering whether the evaluation risk assessment deems them, in a safe to release, or deems them incompetent to stand trial, or anyway, based on all of that. So the court also has to consider, do they have the mental health resources in the community to be released out there? So again, I might do some assistance in helping make an appointment with them, or connecting them up with their family member that can make that appointment for them, so they have that outpatient connection upon release, and hopefully they will follow through. So in the compliance monitoring, the court also has the option of ordering that upon release, they have to see their mental health therapist. They have to take medications that are ordered. And this is a tricky one for the court because there's challenges with ordering people to take medication. And then the compliance monitoring, they can be monitored on a GPS device, considering somebody's potential for running or whatever, and then being assured that they're going to make their appearance back into court. And if the court feels that all of those things can be met, then they can release them back into the community, maybe on bail or OR. And at that point, if they're on community supervision already, then what the court's going to do is order them to report directly to the probation officer, and then we're going to set up to meet with them on a weekly basis to monitor how they're doing. And at that point, what I do is I do some work with becoming a resource navigator and doing what I call casting a net upstream in this process. Next screen. Thank you, Mindy. So the defendant is released and connected with resources, hopefully. Either the defendant's attorney or myself connects them with some resources for their own personal safety and the safety of the community. Encourage them to stay in contact with their attorney as required by law. This is a challenge with a lot of people with mental health issues because they may have issues with authority. They may have cognitive issues with following directions, or they may have issues with keeping instructions, or they're paranoid and they don't trust anybody. And so a lot of times this is where we lose them, not because they've gone out and harmed anybody, but because they have a hard time keeping their life in order. And so this is where, if they're already on probation or parole, the weekly appointments with me, I can say, okay, so you met with your counselor, you're still on your meds. How else can I help you? Referring them to other resources and helping them stay connected with everybody. And then reminding them of what their release conditions are, whether it's on a drug patch because they have co-occurring disorders, or checking in with their therapist every week, or whatever it happens to be. This is where we can end up having violations of the release conditions and or probation, and they get rearrested. And so now we've just spent 6-9 months, a year in jail, and now we're back in jail. So the rearrest, the challenges again are that they might not have been on their medications, and we got to start that all over again. The same process, making the doctor's appointments, getting the medications from the pharmacy, who's going to pay for it, all of that. So we're still in pretrial. The court considerations are, again, the speedy trial, public safety, the defendant's rights, and the victim's rights. Now, if they're on probation or parole, I'm keeping the victim's rights and their safety throughout this process, whether it's the victim in this current crime, the new crime, or the crime they were convicted of before.
Excuse me, Lynn,
Yes.
can you hear me? This is Deb.
Yep.
So this is great information, and we have half an hour left. We need to get Gail in, and then we need to get Mindy in. So if we could ask you just to kind of wrap it up, and then we'll have still time for questions, concerns, or comments. Is that okay?
Okay.
All right. Thank you.
So let's skip a couple of screens here down to the last one then. So I'll wrap up with this. Right in the center, there's a probation ongoing. So whether it's a new offender or it's somebody that's been on probation or parole before, my new title is Resource Navigator. I try to keep on top of whatever resources are in the county. And we have private therapists, and I could name each one, but I'm not going to. We have the Western Montana Mental Health Center. I consider the ER a resource, any medical provider, Providence. And then I recently learned that the Sanders County Coalition for Families has a therapist that is going to be providing some services, if I understand it correctly, specifically to victims of crime, but oftentimes the people that are on felony probation are also victims from other crimes. They may have a victim from their crime, but they are also a victim. So I haven't had a chance to talk to Gail about that yet, how that would work. But so then I try to cast a net upstream, and that's promoting the physical, emotional, mental wellness, and try to strengthen the individual so that by the time they return to the community, we've helped to prevent a suicide throughout this whole process. And we've helped them gain some resources that they can rely on, and some skills to move forward in their life. And I hope in the process of all of this, I've helped this group understand some of that, what we do with them. And I guess that's it. I didn't realize I took so much time.
Goes by quickly, but thank you so much, Gail. Really, not Gail, Lynn, for putting all of that together. Our next speaker is Gail Surratt. She has been the Executive Director of Sanders County Coalition for Families for 11 years, but she has been in this profession for over 2 decades. She made it clear to me that the coalition isn't a mental health provider or a professional mental health source, but their work is considered as peer counseling. In other words, they are there to assist victims of either domestic abuse, sexual abuse, child abuse, stalking. So actually they're there to help people try to sort out and solve their own problems. So with that, Mindy, again, I'll ask you to unmute Gail Surratt.
Gail can unmute herself, I hope.
Okay.
If not, I can provide an assist.
Okay, thank you, Deb and Mindy, for inviting me to speak here. And Lynn, I really appreciate all your homework that you just presented to us. I'm flying way more off the cuff here. We are Sanders County Coalition for Families. We provide advocacy services to victims of domestic and sexual violence, stalking, dating violence, child abuse. We have many ancillary type services. We do a lot of information and referral for victims. As far as mental health is concerned, we do not work within the system like what Lynn does, but we work alongside the system. Our program, we have no teeth per se in terms of making anybody do anything. It's strictly voluntary services. What I see as issues are the issues that we all face as service providers, the poverty, the joblessness, the lack of education, the generational abuse that we see. Personally, I've worked with 3 / almost 4 generations of the same family within my 2 decades of work, which is really disheartening because the violence and the mental health become normalized, and it's difficult to see the tree for the forest of what normal is viewed as. One problem recently that I've encountered is a perpetrator with a fairly significant mental health issue, and it raised enormous risks for the victim. I saw some videos that she shared with us, and her level of what was norm was way off my charts in terms of red flags and is this guy gonna drive off the road with her and the children in the car? So I think having access to mental health services as well as doing outreach and providing community education that these are some of the red flags of mental health issues. How can the average person on the street access the services? Getting in to see someone can be a little bit difficult, very time consuming, as Lynn pointed out. Oftentimes, perpetrators who do go in jail, they get released before there's any kind of evaluation or before the attorneys that we contract with can get in and request the court order psych evals and chemical dependency evals. So the system has to all work together to support these families with very serious issues. The other concern that's happened to me recently is I basically had to let a client go because the mental health issues were so severe. It was way outside of my scope, way beyond my hourly wage. I am not a professional. And this person was so impaired that for the safety of my program, for the safety of my advocates, I terminated services to this person. And this person is still a victim and they definitely need support, but I couldn't provide that level. Part of what SCUF does as well, we are part of the sexual assault response team as well as the coordinated community response within Sanders County. And I had heard, I think there's someone on here from Mineral County, that Mineral County is trying to add Sanders County into a program they have where should law enforcement go out to a scene, and they've determined, one, that it's safe, and two, that a mental health provider would really be able to help in that situation, that there could be a rotating list of providers who could come to the scene, and then law enforcement would be able to be released to respond to other criminal 911 calls throughout the county. So that would definitely free up the system, because right now, if law enforcement goes out, if there's a mental health issue, law enforcement can't leave until someone else comes in and takes over the case, or until I don't know that process. But I think having a cadre of mental health providers to respond on scene in the moment would be so helpful, because then issues would get resolved without waiting the 6 and 9 and 12 months. They would be addressed immediately, which would then keep victims safer, keep children safer, and actually keep the perpetrators safe as well. So that's kind of my spiel. And anybody can call for help. Oh, Lynn, to address your what SCUF provides, through one of the grants we do reimburse. It's Cabinet Mountain Counseling, Raul Ribeiro. He does emergency crisis counseling for the people we work with, should they want it and ask for it. By no means is it mandatory to receiving services. If they do seek services from Cabinet Mountain Counseling, we don't have access to any of that information, so the confidentiality is retained between the counselor and the person seeking the counseling. Additionally, Raul offers through SCUF a weekly support group for victims of domestic violence. It isn't just women, it's for men as well. There is a phone number. Anybody can call Scuff's office, which is 827-3218, and we can get them hooked up with Rawl for the support groups. And I'm open to questions.
I have a question. It seems overwhelming, and we haven't even touched the school population that we started this whole program out with. So here we are in Sanders County. We have one of the highest at-risk populations. Fentanyl has made a big splash in the news. So we're talking about, and the whole drug culture. And here we all are, you know, all warmed by our fires, we're well fed, etc. And it's sort of amazing to me, the intricacies of both the judicial justice, probation program, SCUF. What can we do? What can we do in our comfortable homes and you know, and again, I want to cross the partisan barrier. What can we do as citizens to help the mental health well-being of our county? So I guess that's wide open, and if anybody wants to take that answer, be it a school person or a SCUF or probation officer, please let us know.
I'm just going to jump in here real quick. What I see is that it's very easy to get buried in your own backyard and to get tied up in your own life and what's going on. And I don't want to get in anybody else's business. The drug business, the kids, like Mindy, you said, it takes a village to raise a child, but that village has to have eyeballs, and that village has to be willing to say, but you don't want to get in someone else's business either unless you're invited. So I think having a plethora of information out there available on the counters at the local store, at the courthouse, be it flyers or business cards or, I mean, we put up monthly flyers saying, hey, if you need help, give us a call. So much of what we do is information and referral. I don't care if you're a victim or a perpetrator, if you need to find a phone number or a name or a resource center to get information from, we can get you that phone number. So it takes eyeballs in the community that are, I don't know. People don't want anybody else in their lives, but the information has to get out there some way. Thanks.
So this was a screen I was trying to show earlier, and it's just shocking. So notice this is in Montana. This isn't someplace else. This is here. So high school students with depression. How many are homeless? 1 in 4 live with a serious mental illness. Sorry, I'm going to shut that off that way. Suicide. 2 in 5 adults are in jail or prison, have a history of mental illness. This is sort of a shocking, this isn't even sort of, this is a shocking report. Notice at the bottom, it says from 2021, that isn't too long ago. And I'm going to have to, in order to get to the next screen of National Alliance for Mental Illness, I have to stop sharing the screen and start sharing the screen. But this is something that we can start from. I mean, this is something that could be posted. Did you know? Anyway, I wanted to make sure that was out there.
Mindy, I have a question, because in that same National Alliance on Mental Health, there's 500,000 people in the state of Montana who live in a community without a sufficient amount of healthcare professionals. I'm assuming that we fall into that category. Do we, Gail or Lynn? Or I see Vina is here someplace too. Do we fall into that category? There simply aren't enough mental health providers here?
Can I respond a little bit?
Sure.
Okay, so one of the challenges here also is, since the Department of Health and Human Services defunded having our local Medicaid food stamp office, what I see is that has also affected, not only do we have, it's difficult to get into mental health providers because of transportation, because of low income, but now we have people. I've just worked with a young man for 6 months just to get Medicaid. I personally put my phone, I called into the 800 number, and for 3.5 hours was on hold in my office trying to get a person on the phone to help him enroll in Medicaid so he could get his mental health services. 3.5 hours to even get somebody on the phone, and then we got cut off. And so for 6 months we've been trying to do that. So part of it is not just the barrier with maybe not having enough providers, or it taking months to get into the mental health office at Western Montana Mental Health, because they've had a lot of staffing changes or whatever, but it's not being able to sign low-income folks up to the Medicaid. And it's easy to say, well, just go online, but do you want to put your social security number and date of birth into the public computer at the library? I don't. And a lot of these folks don't even have the internet or a computer. So we've created a tremendous barrier to services just by closing the local Medicaid offices.
So does that have to do with consolidating social service local programs that used to be out at the old state building, Lynn, and that are now down? You have to either go to Missoula or Kalispell. So now we're talking legislative funding for outreach.
Yes.
I'm just asking.
Yes, that's exactly what happened. 19 offices across the state were closed.
And so that's something that we can look for. It's a whirlwind of 90 days in 2023. And whoever gets elected in November, working across the aisle and working with those representatives to reinstate social service offices that are essentially satellite offices. It was just a travesty to have closed that state building office in my mind.
Mindy, one resource for you, Lynn. The hospital has done a lot to work with getting folks signed up for Medicaid, and you might call down there and ask for some assistance. They're pretty skilled at it.
Thank you, Bina, for reminding me of that. Yes, they are doing that, and the Western Montana Mental Health Clinic can too. Part of the challenge is that poverty of not even having a vehicle or the gas to even get there. And so I have done some transportation in some dire, but that's a challenge too. But yes, you're right.
Sanders County Transportation, which is underneath the Sanders County Council on Aging out of Hot Springs, they have a van, and people call it the senior van, but it's available for anybody to use. You don't have to be a senior.
Right, but you do have to have $9 to travel across the county. And if you don't even have that, and and I'm not trying to make excuses for anybody, because I try to support them in getting creative to earn that $7 or that $9 to get that done. But that there are a number of barriers, not just the lack of a number of counselors, but getting to that. And so as the resource navigator, that's what I try to do, is problem solve. Okay, so maybe you go shovel snow for your $7 so you can ride the bus to sign up.
And then the bus only, you have to make appointments for it, and they don't always go or come when you need them to. They can get you to Missoula or Kalispell or up into North Idaho. But again, you have to have the money, and two, it has to work within your schedule, which is problematic.
I just wanted to say that the hospital, I think it was the Hospital Association or the Physicians Association, maybe you could speak to this, Bina. There was a couple of ladies that are doing some outreach, and they are trying to reach out to help people get signed up for the for insurance or Medicaid, and they're doing some outreach, and they just came to my office and gave me some brochures, and they're going to be coming back to this area, and I'm going to offer my office and have a day that I can bring some people in to sign up with them. And so that door just opened. It's going to be able to help. But again, I really believe we need some legislative change that says, here's some money to have local services, because the low income barriers to not having the internet to sign up, to not having a vehicle that even runs, or having a driver's license, and that cycle of poverty is such a huge barrier. I think we have to go back to bringing the services. And I'm not talking, I want to give a handout to everybody. That's not where I'm at. I want to give them a hand up. If we want them to be productive members of society, we have to do what we can to help them do that, I think.
So the vet program used to have one day a month. I see Lyman's are on here. Dave could maybe speak to this a little bit more. One day a month at the credit union. It would seem like social services could also have, a one day, they could move their office around. Of course, if you're talking confidentiality, it's difficult to have multiple locations and maintain confidentiality. But we also have a candidate for HT13 also on here. And one of the things that could be creative is instead of having a social services office, but having a circuit social service person, and they could go to different, to recognize the need is in the rural counties. And so perhaps we can make that happen again, that rural counties are served.
We started out this evening talking about children and suicide. And also from the National Alliance on Mental Health is a statistic that over 50% of children ages 12 to 17 diagnosed with depression did not get help in 2021. So what about the kids? What do we have here for children? It has to be affecting the school district in some way. Anybody have a comment on that?
So I work up in Knoxon School, if it's okay if I speak for a little bit. And it definitely affects our student population and our young people. I think that's everywhere. That's not individual just to Sanders County. I think that's nationwide, and that's why you're seeing students and young people kind of rise up and demand more access to mental health services, especially with higher demands on their time in terms of academics and extracurriculars. But I know this is my first year here. I'm new to the county, and just it's been week after week of kind of hard cases, and having students come in who definitely have suicidal ideation, or who are worried about friends who've experienced suicidal ideation. And so it's really real. It's really real here. Like I said, I'm working in Knoxon, and we lost a student last year to suicide. And so it's definitely something that's felt here. I would say for sure the lack of access to resources is a component to that. And I resonate with, I believe it was Lynn, you were talking about having to, or Gail, sorry, talking about having to refer or in services because the need of people is outside of capacity or competency. I feel, sometimes we're running up against that at the school, that these students are needing more than teachers and mental health staff at the school are able to offer them. So it's challenging right now. I know one of the research going on right now is speaking a lot to opportunities for connection, right? Isolation breeds despair, and the more opportunities for connection that students have, the more they feel supported and grown by their communities, and that there is a place for them there. That's generally where I go when thinking about solutions, is just how can we plug students into areas that make them feel connected, supported, and grow their sense of self-worth. And yeah.
Thank you for speaking up on that. It does take a village. It does take a community. I see that we're almost out of time. I do want to show this one more screen that sort of sums it up, and it's a little shocking too. We have got to get a grip on our mental health in order to have well-being in our counties. And I'm hearing connections. I'm hearing some opportunity and some ideas, and I hope we can take that beyond this conversation and this recording here, and put it into action, whether it be a village, even though you don't want to go into somebody's backyard, Kale, and even though I'm not comfortable going into nor qualified to go in to help those that are incarcerated. We just have to have this sort of uppermost in our mind and continuing the conversation. So I will stop this share. And if anybody has any closing comments, Deb?
No. Well, yeah, thank you everybody for coming today. I think we've just barely touched the tip of the iceberg on this, but at least there's some people here may have learned something, and maybe there's something that all of us can do. But I don't think it's something we should just be talking about today and we're forgetting about it tomorrow, and as Dale said, going into our backyards again. I think this is of grave importance right now. I really do. So I don't know. That's all I have to say. But thank you all for coming. And thank you, Gail. And thank you, Lynn, very much.
Thank you. And thank you everyone for your courage and your bravery for stepping out there every day.
Yes.
There has to be something we all can do. This is wild. Thank you.
Yes.
Thank you.
Thank you.